How Gaza's hospitals became battlegrounds. Gaza's hospitals have become battlegrounds in recent conflicts due to a complex mix of military, humanitarian, and political factors. Here's a breakdown of how and why this happens. 1. Hospitals as vital infrastructure in conflict zones. Hospitals in Gaza are critical infrastructure, not only for medical care, but also for shelter. During escalations in violence, civilians often seek refuge in hospitals, viewing them as protected spaces under international law. Medical facilities become overwhelmed, under-resourced, and sometimes used as last safe havens. 2. Allegations of militants operating within hospitals. Israel has frequently accused Hamas and other armed groups of hiding in or operating from within hospitals and tunnels underneath them, using medical facilities to shield fighters and weapons, knowing Israel is less likely to strike them directly due to the risk of civilian casualties and international condemnation. Example: Al-Shifa Hospital, Gaza's largest medical facility, has often been at the center of such accusations. Israel claims Hamas uses it as a command center, a claim Hamas denies. 3. Israeli military raids and strikes. Israel has carried out targeted operations on or near hospitals, citing security threats. These actions have included airstrikes in the vicinity of medical facilities, ground raids aimed at uncovering alleged tunnels or militant activity, demands to evacuate hospitals for operational reasons, which are often impossible due to the presence of patients on life support or lack of transportation. 4. Humanitarian consequences. Collapse of the health system. Power outages, fuel shortages, and bombardments severely limit hospitals' ability to function. High civilian casualties. When hospitals are hit or surrounded, not only are patients and staff endangered, but access to emergency care across Gaza is disrupted. International concern. Organizations like the WHO and UN often condemn attacks on healthcare and call for protection of medical personnel and infrastructure. 5. Legal and ethical dilemmas. Under international humanitarian law, IHL, hospitals are protected spaces unless they are used to commit acts harmful to the enemy. However, determining what constitutes military use is often disputed. Even if military use is proven, any attack must be proportionate and necessary. The use of civilians as human shields by either side is itself a war crime. 6. Information war. Both sides use hospitals symbolically. Israel points to military misuse to justify operations. Palestinian groups and rights organizations highlight the humanitarian toll and accuse Israel of collective punishment and indiscriminate attacks. Media coverage often shapes global perceptions, especially when hospitals are struck and civilian deaths mount. Please like and subscribe.